Just as the gut microbiota provide a natural protective layer against pathogenic organisms, more and more research shows the vaginal microbiota play a powerful supportive role. These healthy bacteria provide protection through multiple mechanisms, including adhesion to epithelial cells and producing natural antimicrobial compounds, including antimicrobial peptides and bacteriocins. Beneficial probiotics can modify the local environment, downregulate inflammatory cytokines, and increase the production of short-chain fatty acids such as butyrate. Remember, short-chain fatty acids like butyrate not only provide energy for epithelial cells to repair and reproduce, but also activate immune cells and increase resistance to bacterial pathogens. Knowing this, Biotics research combined two clinically validated probiotic formulations, Astarte and Clepias, in a product called BioDoph-Fem. Both probiotic formulations in BioDoph-Fem have demonstrated efficacy in clinical trials for vaginal and gastrointestinal health and resolution of symptoms related to dysbiosis. BioDoph-Fem contains 5 lactobacillus strains. Let's talk about each formula separately. Let's start with Astarte. It's a combination probiotic comprised of 4 lactobacillus strains: L. crispatus, L. rhamnosus, L. gesseri, and L. jensenii, isolated from healthy pregnant women in the first trimester of pregnancy. Healthy asymptomatic women were found to have lactobacilli as the dominant species. Lactobacilli is associated with the reduction of a number of urogenital diseases such as bacterial vaginosis, yeast infections, sexually transmitted infections, and urinary tract infections. One of the reasons lactobacilli are so protective is they produce hydrogen peroxide, H2O2. H2O2 inhibits colonization of the urogenital tract by E. coli. So a greater abundance of hydrogen peroxide generating species creates an environment that reduces the risk of a UTI. Bacterial vaginosis is in effect vaginal dysbiosis and is characterized by a lack of lactobacilli, particularly L. crispatus. Concurrently, there's an overgrowth of an anaerobe bacteria such as Gardnerella vaginalis. Clinically, this leads to a development of vaginal discharge, pruritus or intense itchiness, and additional symptoms. The absence of hydrogen peroxide producing lactobacilli combined with the growth of anaerobe bacteria lead to a more basic pH. A basic pH creates a perfect storm for bacterial biofilms that are more resistant to antibiotic therapy, as well as an increased susceptibility to sexually transmitted infections, as well as other gynecological diseases like endometritis and inflammation of the fallopian tubes. Biofilm production by pathogenic species like G. vaginalis is likely the reason that antibiotics used in isolation are often ineffective, resulting in recurrence after treatment. The 4 probiotic strains in Astarte were selected out of 127 potential strains after a step-by-step selection process designed to find the optimal probiotics to promote vaginal health. The 4 strains were chosen based on antibiotic resistance, lack of mucin decay, their ability to generate hydrogen peroxide, and lactic acid. They were also selected because they survive stomach acid and bile salts. They possess the ability to grow in both aerobic and anaerobic environments. The 4 probiotic strains in Astarte possess the ability to inhibit the growth of a number of vaginal pathogens, specifically E. coli, G. vaginalis, Candida krusei, Candida albicans, and Candida glabrata. Both L. crispatus and L. jensenii are strong hydrogen peroxide producers, creating a more hostile environment for pathogenic species. Multiple clinical trials have been conducted to evaluate the lactobacilli combination in Astarte. Studies have shown that pathological organisms decrease, whereas beneficial bacteria increase even though they're not supplemented. This shows the value in creating the optimal environment. The body wants to restore the optimal probiotics when given the opportunity. The second clinically validated probiotic in BioDoph-Fem is Clepias. Clepias contains a specific strain of L. plantarum shown to support gastrointestinal health and relieve symptoms such as discomfort and bloating. L. plantarum is a commensal bacterium in humans previously reported to support the integrity of intestinal barrier and to reduce intestinal permeability. Two of the mechanisms identified are the upregulation of tight junction structures and the increased short-chain fatty acid production. The L. plantarum species is noted for its ability to survive in the gastrointestinal tract. Clepias supplementation alone has been shown to help with IBS symptoms, including disease severity, abdominal pain and discomfort, IBS-related quality of life, perceived stress, and stool consistency. These are exciting times when highly specific targeted probiotics from healthy women can be identified, reproduced, and combined to provide the probiotics that change the environment of both the vaginal and gastrointestinal tissue. Consider BioDoph-Fem at 1 capsule BID independently or in conjunction with other known therapies. Thanks for watching. I look forward to being with you again next Tuesday.